Hello everyone and welcome to the pharmacology video for MSK. Before I get started, I would like to extend a special thank you to Kyra because she helped me draw almost all of these and she colored all of them, and her coloring skills are way better than mine, so they look great. And with that, we'll get started. And we're going to get started with NSAIDs. So NSAIDs are all these top pictures here, and unfortunately, a lot of these we've already covered before, and so I have a lot of different ways to remember, so they're not really a cohesive picture. But we'll start over here with aspirin. So again, we have an aspen tree for aspirin, and there's a canoe or a rowing team here along a river beside the aspen tree, and the way I remember the mechanism of action of aspirin, which is that it's an irreversible COX-1 and 2 inhibitor, is that the person who sits at the top of the boat who calls out the when to row on a rowing team is called a coxman or a cox. And he is sitting in reverse compared to all the rest of the people. So aspirin is a reverse COX-1 and 2 inhibitor. Adverse effects are bleeding and bruising. So there is a red person and a purple person for bleeding and bruising. Next, we have an Indian here who is representing indomethacin. And we have Abu from Aladdin for ibuprofen. The Indian is holding a napkin for naproxen. We also have celecoxib and meloxicam. And so, again, these ones in this section are COX-2 inhibitors. So we have two COX, two chickens. And this chicken or this cox is celebrating. He's got a party hat and a little noisemaker, whoop whoop, for celecoxib. And then this one is holding a melon for meloxicam. Adverse effects of meloxicam, and I believe some of the rest of these, are GI effects, which is why there's a stomach here, renal, kidneys, antiplatelet, and there's a risk in pregnancy. Then we move on to Voltaren, which is also known as diclofenac, and ketorolac, which in this case is also known as Toradol. And this is again a repeat drawing from our heat module, so not everything in this picture really applies, but it inhibits cyclooxygenase. Anyway, this is COX. So it inhibits COX and reduces prostaglandin synthesis. And I believe it's still COX-1 and 2. And the way that I had this shown is, so first of all, this is an N and it's saying something for NSAID. And then we have some oxygen tanks in a like a tornado, a cyclone, whatever those are called, which is how I remembered cyclooxygenase. And then this is a prostitute for prostaglandin synthesis. Adverse effects are burning and stinging, and then there was reduced healing time. And so basically, if you just remember that NSAIDs are COX-1 and 2 inhibitors, and that they have GI effects mostly, you should be good. Over here we have acetaminophen, and so to remember this, we have Tylenol. So this is a bow tie, and it is on a stripper pole because it inhibits prostaglandins. Prostitutes dance on stripper poles. We have a big red X here because we are inhibiting prostaglandin synthesis, which is COX-2 and 3 in the CNS. So here we have, again, another chicken, another cock, and it has the numbers 2 and 3 written on it for inhibiting COX-2 and 3. Adverse effects are hepatotoxicity and GI, so the chicken food. This whole bottom picture here is all for our opioid analgesics. The mechanism of action for all of these is that they bind to mu, kappa, and delta receptors. So here we have a little cat, and he's like, and kappa, delta. So this is like a sorority house in the background here. And the sorority house, they got a pool, and if they're located in downtown Flint, well, they have meth heads that just like to walk by the sorority houses. Anyway, it's not really a coherent picture, but it's okay. So first drug we'll talk about in this category is morphine. So here we have some butterflies that are morphing, a caterpillar morphing into a butterfly, morphine. It is a vasodilator. And we also have oxymorphine. So this butterfly, his body is an oxygen tank for oxymorphine. We have a tan fence for fentanyl, a tan fence. And this is 100 times more potent than morphine. And then we also have oxycodone, which is a cone with oxygen on it. It's for oxycodone, a cone of oxygen. And we have Vicodin, so a Viking for Vicodin. We have we have normal, like codeine, so this is supposed to be representing the computer coding. And then you have more coding, but it's around a pool, so it's hydrocodone or hydrocodone. And then finally we have methadone. So this meth chick, she's got her arms crossed and she's like, I'm done with meth. Methadone. So all of these have adverse effects of analgesia, duh, that's the whole point. That's why we're using them. Respiratory depression. So that's kind of why we have oxygen in this picture. Sedation. So we have like a seed right here. And then altered GI motility. So altered GI motility. And then there's abuse potential. I show that with an apple because they start with the same letter, apple, abuse potential. I don't know. So that is your opioid analgesics. And so now we'll go on to some what are called partial opioid analgesics. And so we have this doll holding that sorority flag again, and a finger with a nail on it. So a long skinny nail here for nalbuphine. It is stabbing this doll, stabbing the doll, stab doll, also known as butorphanol. And it is going to partially, oh, one more. And then there's a Subway sandwich box. Okay, Subway sub for Suboxone, also known as buprenorphine. And anyway, so these are partial opioid analgesics. So we have part of a sorority flag here. And again, your receptors are your mu, your kappa, and your delta. Changing gears a little bit, we have narcotic antagonists. So there's a couple different mechanisms of action here. So Narcan, the mechanism of action is just this. It's a Narcan antagonist. It like inhibits narcotic something or other. I know that's not very specific, but anyway, so we have a narwhal on a can for Narcan. Then here we have a van that is parked in a no parking zone. And this dinosaur is like, move your van. Move your van for Movantic, also known as naloxone. And so this medication is an oral opioid antagonist, and it may cross the blood-brain barrier, which is why we have blood and we have a brain. Adverse effects are GI pain, diarrhea, and withdrawal syndrome. The T-Rex here, this is the same one that was drawn for one of our other, it's for the GI system. This is a subcutaneous opioid antagonist, and it also may cross the blood-brain barrier. So these two pictures go together. And the reason why he's a T-Rex is because it's methyl naltrexone instead of methyl naltrexone. Also, the dinosaur's name is Male. Nail the T-Rex is like move your van, move antics. And then we have this guy over here. He's meditating. He's bald. He's a bald guy meditating for Naldemedine. And he's like having a moment where he's like, oh, I see into the future. Oh, I see, because this treats OIC, opioid-induced constipation. This is an oral opioid antagonist, but unlike these two, it does not cross the blood-brain barrier. Some other random drugs that I'm not sure what category they fit under, but we have this tape here for tapentadol or tapentadol. And there's a compass on the tape that's showing northeast because this is a norepinephrine reuptake inhibitor. Okay, so it's an opioid agonist. Adverse effects are nausea, dizziness, so the star is dizzy, constipation, because this is a constipation constellation, and then abuse potential. We have our apple again. We also have tramadol, so this is a tram, like a city tram, and its mechanism of action is that it is a serotonin reuptake inhibitor, so serotonin, SE, so we have, again, another compass, and it has SE. Also, it's serotonin, makes you happy. The bus has a little smiley face on it. And the adverse effects are the same. So again, nausea, dizziness, constipation, and abuse potential. Moving on to our benzodiazepines over here. So these ones all have the mechanism of action that they increase the affinity of GABA receptor. And the main point here is GABA is always represented by garbage, the garbage. And so we have the Lorax, who is vacuuming up the garbage, and we have a clown and an alpaca. So the Lorax for lorazepam, he's using a vacuum for Valium or diazepam, a clown for clonazepam, and then an alpaca for alprazolam. And some of the adverse effects are shown here in the garbage. So we have American cheese for amnesia. We have a seed for sedation, again, abuse potential. Anyone who's on benzos can be a fall risk. So we have a fish for fall risk, and then an empty can for CNS depression, also shown here with the spine, like CNS, I don't know, yeah, CNS something rather. Okay, next is our skeletal muscle relaxants. So we have baclofen. So we have a shark here. He's got a fin on his back, baclofen. And the mechanism of action is that it decreases the release. Is it like a GABA agonist? So the shark, he's in the ocean and he's swimming around garbage. Like this is a plastic water bottle, and these are like those plastic water bottle rings, and that's a trash bag. So garbage for GABA. And adverse effects are sedation, so there's a seed in there as well. And we have Tarzan here, and Tarzan is walking two alpha dogs. So Tarzan for tizanidine, he's walking two alpha dogs because this is an alpha-2 adrenergic receptor agonist. Adverse effects are dry mouth, so pretend Tarzan here has dry lips, sedation, and then it can make you hot, so red leash, I guess, and also probably drop your blood pressure. More skeletal muscle relaxants. We have robots that are fighting, so robots or Robaxin. These are it said in the notes that both the mechanism of action and the adverse effects are CNS depressant. Don't really know how that makes any sense, but this robot looks like he's depressed, and there's his central nervous system. Not really his central nervous system, but you get the point. Then we have Prince Eric from The Little Mermaid, and he is flexing for Flexeril. And this inhibits acetylcholine. That's it, or it's anticholinergic, and its adverse effect is sedation. And we have one of those carousel horses, carousel for carisoprodol. This one's mechanism of action is again a CNS depressant. So here's our central nervous system, and it looks like it's depressed. Adverse effects are sedation, abuse potential, and then agitation. Again, that looks not only depressed, but a little agitated too. We have Skelexin, so a skeleton for Skelexin, and it's also a CNS depressant. Adverse effects are GI and sedation. Then we have our classic Botox. So just straight up drew a lady getting a Botox injection in her face. She's got a little chloride here and acetylcholine here because this inhibits chloride channels and prevents acetylcholine release from the presynaptic neurons, and it blocks nerve impulses. Adverse effects are injection reactions and muscle paralysis. And we have Dan. Dan was jumping on the trampoline and he fell off and broke his leg. So Dan on a trampoline for dantrolene. This mechanism of action is inhibiting calcium release from the sarcoplasmic reticulum. So sarcoplasmic reticulum is in your cells. So this trampoline is a circle like cells are. And it says got milk because milk has calcium in it, and so it inhibits calcium. And maybe he had calcium that was inhibited, and that's why he broke his bone. Adverse effects are hepatotoxicity. And I abbreviated this, and now I don't remember what it stands for. Bone marrow suppression. That's what that is, bone marrow suppression. Okay, talking about some topical analgesics. So here we have capsaicin. So I have a cap full of vanilla because this is a transient receptor potential vanilloid 1 or TRPV1 agonist, which downregulates nerve pain. So a cap full of vanilla for this vanilloid thing and capsaicin. And adverse effects are burning at the application site and then pain. And then just some other topical analgesics I didn't feel like drawing are lidocaine, menthol, this trolamine, silicate, and diclofenac. Then we have adjunctive agents for pain. So right here, we have Elvis riding on a tricycle. I know that doesn't look like Elvis, but it is. Elvis was really desperate to get back to Pamela, his current girlfriend. So Elvis, for Alavil, was desperate, desperamine, to get back to Pamela, Pamelor. These are 3 types of tricyclic antidepressants. So tricycle for tricyclic. And the adverse effects are that they have anticholinergic effects, sedation, and it can be fatal in overdose. And if we remember, Elvis overdosed and he died. And that also, this picture also helps you remember that. So then we have some serotonin and norepinephrine reuptake inhibitors. And the mechanism of action is just that. And so we have some symbols for Cymbalta. This little face that is salivating for Savella. And then a feline playing a violin. Feline violin for venlafaxine. So like feline, vaccine, violin, vena. It's a far stretch, but it works, I guess. Adverse effects are nausea, so this is a little vomit bag, dry mouth, and sedation. So then we have some drugs that are for rheumatoid diseases or disease-modifying anti-rheumatic drugs, also called DMARDs. So here I have these people that are dancing at a rave for a rava, also called leflunomide. And this mechanism of action is that it inhibits T cells. So there's a big T that's crossed out on here. Adverse effects are diarrhea, opportunistic infections, bone marrow suppression, and liver injury. Then we have our good old sulfasalazine, or 5 salamanders on a sofa. 5 salamanders because this is a prodrug of 5-ASA. Adverse effects are bone marrow suppression, rash, headache, and GI, which are all kind of shown on these different things. And it's anti-inflammatory, which is shown on the orange one. We have etanercept, which this is a lady who's getting a fake spray tan. So a tan for etanercept, and it's a fake spray tan because this is a sham or a fake TNF receptor. Adverse effects are immunosuppression. So she's got a cold pack and a thermometer in her mouth because she's sick. She's got TB, she's got infections, and because her immune system's suppressed. And then you can also get lymphoma and cancers. We have this guy, Adam, who is watching Netflix, and he is a certified Netflix watcher. And that is because all these drugs, so certolizumab, adalimumab, and infliximab, are all monoclonal antibodies against tumor necrosis factor alpha. So we have an alpha here, and adverse effects are infusion reactions, unusual infections, and then lymphoma. We have Gollum from Lord of the Rings for golimumab. This is a monoclonal antibody against tumor necrosis factor. Adverse effects are opportunistic infections and then injection site reactions. We have rituximab. So this is a lizard wearing a tuxedo. This is a monoclonal antibody against CD20. And then tocilizumab. So again, a lizard, and he's got big toes, tocilizumab. He has 6 toes, 1, 2, 3, 4, 5, 6, for that it is an IL-6 receptor agonist. The lizard is playing baseball. He's playing t-ball. So he has a baseball bat for a battercept. And he's playing t-ball because this inhibits T cell activation. Adverse effects, again, are the same as a lot of these other things, so just opportunistic infections and injection site reactions. Here we have 2 people. They are sisters or brothers, whatever you want to call it. They are kin to one another for anakinra. And people who are like, the 2 of us are kin. We come from one family. We are one family, so IL-1 antagonist. Again, adverse effects are things like opportunistic infections. Then we have our Janus kinase inhibitors. And so Janus always kind of reminds me of like Japanese for some reason. And they're kind of similar to your TKI, and TKI always reminds me of TKO, so people who are fighting. So we have a Japanese fighter. We have 2 different types. We have this chick who's a kung fu fighter, and she's holding tofu. And then we have this sumo wrestler who is very large. He's bariatric. So a Japanese fighter holding tofu for tofacitinib and then a bariatric fighter for a Japanese bariatric fighter for baricitinib, bariatric baricitinib. Adverse effects are infection, thrombosis, so that's supposed to be a blood clot right there, lymphoma, and neutropenia. And then this is just the symbol that's like, hey, it's time to update your computer for updacitinib. But it's another one of the Janus kinase inhibitors. Give me 1 second. Okay. Now we're going to move on to bisphosphonates. These are for osteoporosis. So we have Aladdin. He's flying a drone while eating some fruit cups out of one of those Dole fruit cups. And he has a band on top of his head. He is zooming around on this magic carpet that has risen from the ground. So Aladdin for alendronate, and also flying a drone for droning. So Aladdin flying a drone, alendronate. He's eating a Dole fruit cup. Dole for zoledronic acid. He has a band on his head, an apple band, an eye band for ibandronate. He is zooming around on his magic carpet, zooming around for zometa. And that magic carpet has risen up in the air for rise, risdronate. So these bind to bone and inhibit osteoclast activity. So they bind to bone and inhibit osteoclast. So they're going to, there should be a X through here, I think. My apologies. Adverse effects are esophageal erosion, osteonecrosis of the jaw. Maybe that's what this is for. I think that's what this is for. Your jaw will get, I don't know. And then long bone function, dysfunction. Sorry, I don't know what that's supposed to represent. My bad. Okay, more drugs for osteoporosis. So we have a fortune teller. So fortune teller for Forteo, also known as teriparatide. And this one is going to stimulate osteoblast activity. So blasts build. So that's why they have a hammer, because she's building something. It's going to increase GI and renal absorption of calcium. So that's why she has a big calcium in her ball. That sounds weird. And pro tip, you never want to use these in conjunction with bisphosphonates. Adverse effects are injection site reactions, bone pain. So the handle of this hammer is shaped like a bone right here. And hypercalcemia. So again, the calcium, although it's part of the mechanism of action, sure, eventually you can get too much of it and have hypercalcemia. The rest of these drugs are all for osteoporosis. So we have a dinosaur who is skating on an ice rink. So dino who is skating, so Dino Sumab. He's skating on an ice rink because this is a monoclonal antibody against rank ligand and inhibits osteoclast formation. Adverse effects are injection site reactions, bone pain, hypersensitivity. He's got a little tear dripping down his face. He's very sensitive. Hypocalcemia. We spilled the milk. We spilled the calcium. Hypocalcemia. Osteonecrosis of the jaw, and then atypical femur fractures. Again, he looks like he has a femur fracture right there. Raloxifene. So this guy, he has a big Rolex watch, and a nice watch gets all the hot chicks. That's what he thinks anyway. And so this is a selective estrogen receptor modulator, or SERM. I think SERM kind of looks like the word sperm, and this man has sperm, and he's trying to select a woman who has estrogen by using his Rolex watch. If you followed all of that, good for you. This decreases resorption and increases bone density. Adverse effects are hot flashes. So this hot chick is having a hot flash, and then thromboembolism shown here. Here we have a calculator for calc or calcitonin. This inhibits osteoclasts. So we are inhibiting bones from being broken down. Adverse effects are rhinitis, hypocalcemia, so remember your spilled milk, and hypersensitivity. A lot of these share the same adverse effects, so you can just refer to the adjacent pictures. Going here, we have estrogen replacement. And so this mechanism of action is just that it is estrogenic activity. Increases DNA, RNA, various proteins in bones, decreases reabsorption, increases density. So we have an Easter basket, Easter for estrogen. And yes, these are boobs on the side of the Easter basket. I'll get to it. The handle of the Easter basket is DNA or RNA because that's part of the mechanism of action. And then our adverse effects, so we have breakthrough bleeding. So bleeding right here, breast tenderness, along with breast cancer. So that's why there's boobs on there. And then thromboembolism, and then gallbladder disease. Here we have a bed with a blanket or a duvet on the bed. So duvet for literally like duvet. And there's an Easter egg on there because this is a conjugated estrogen slash basidexine. And again, mechanism of action is estrogen and SERM. So if you think a man and a woman, they go to bed, man SERM, woman estrogen, use your imagination. They have all the same adverse effects as this picture up here. So if your patient has osteoporosis, you want to also prescribe them supplemental calcium, which just helps in forming bone matrix. And the adverse effect is constipation. So we have constipation, constellation. You want to also prescribe them vitamin D. So here we have the sun. This one helps increase the calcium and phosphate absorption in the small intestines and increases renal tubule. I believe this will say like reabsorption. And then this is a snake. There is a type of snake called a chondra. So chondra for chondroitin or glucosamine. And this helps repair cartilage and decrease inflammation. Adverse effects are diarrhea, bloating, and abdominal pain. Okay, so we have one more page to get through. And these drugs are all for gout. And so there is a goat on this page, goat, the gout goat. And up here, we have this cave scene. So there's a lot going on here. So we'll just start up at the top. So in this cave, we have some cave drawings. And again, we have these family members here who are kin for Anakinra. And of course, cave people need to know the date, like the month as well. So we have the month of February on here. February for febuxostat. And this drug inhibits xanthine oxidase. So xanthine oxidase, that starts with an X and an O. Well, in the month of February, you have X's and O's. Adverse effects are rash, GI, allergic reactions, and increased LFTs, angina, and rhythm disturbance. And so I just realized allopurinol and febuxostat kind of go together. Like they both have the same mechanism of action, but they have slightly different adverse effects. So the allopurinol has these ones, and then febuxostat has these ones. But anyway, this is a cat who's purring, and he's by an aloe plant, so allopurinol. So like I said, this is a cave scene from like the archaic times. So archaic for archaeolist, also known as rilonacept. This is a sham IL-1 receptor. Adverse effects are injection reactions, And you want to avoid live vaccines. That's the pro tip. Next, moving on to colchicine. So there's a lot of culture going on here. And this is a canoe. So canoe, culture, colchicine. The mechanism of action is that it inhibits microtubules in neutrophils and slows activation, degranulation, and migration. So slows migration while canoes help you migrate. Adverse effects are GI, bone marrow suppression, and then we have the really old dude here holding a Canadian flag. So Canadian flag for canakinumab. This is again a monoclonal antibody against IL-1. Adverse effects are injection site reactions, bone marrow suppression, liver infections, and he has a peg leg, so a peg leg for pegloticase. This mechanism of action helps digest uric acid. And adverse effects are gout flares and infusion reactions. We have some raspberries over here. That's what the cavemen like to eat, raspberries for raspberry case. This also digests uric acid. Adverse effects are, again, gout flares and infusion reactions. Then you have Ben the goat, probenecid, and this inhibits tubular reabsorption of uric acid. Adverse effect is uric acid kidney stones and bone marrow suppression. And I know a lot of those, like a lot of these drawings are not super helpful in helping you remember the mechanism of action, but they at least help you remember the drug name and that they are for gout, because here's the goat. Then we have some anticonvulsants. So this is a fossil of a foot for phosphonatoin. So toe in, that's why it's a foot. So we have some toes here. This mechanism of action is that it increases sodium outflow and decreases sodium inflow. So the word sodium is written right here. This causes gingival hyperplasia, sedation, and then nystagmus. Other anticonvulsants are valproic acid. So we have a vulture for valproic acid, and he is singing karaoke. There's lyrics, so lyrica, and he's standing by a garbage can, garbage for gabapentin, and then he's about to go through a maze made of bread. Bread is carbs, carb maze for carbamazepine. So the vulture and the lyrica and the gabapentin, they all augment GABA. Remember, garbage, GABA. And then the carbamazepine stabilizes sodium channels. That's why there's a big sodium right here. Adverse effects are weight gain, hepatotoxicity, nausea, sedation, abuse potential, vivid dreams, all kinds of stuff. And then last but not least, we have some tapioca pudding here for topiramate, which is also a sodium channel blocker and a GABA augmenter. Adverse effects are paresthesia, dizziness, sedation, anorexia. So basically, all the anticonvulsants either have to do with sodium channel blockers or GABA augmenters, and they all have similar side effects. And that is it for our musculoskeletal farm.